we can ensure that this webinar is an interesting use of your time. The speakers that we have lined up are very knowledgeable on the subjects, and it's certainly a very topical subject that we're covering today on the pandemic and vaccines. Myself, I'm head of the NGO and Civil Society Centre at ADB, and it gives me great pleasure to be hosting such a wonderful set of speakers on this subject of vaccines, which I know is on everybody's minds. It's very timely here in Manila, which today we've just gone back into lockdown, and there's an evening curfew that we're struggling with. The pandemic has been challenging countries and development stakeholders across Asia and the Pacific. So our topic today on promoting equity and good governance in COVID-19 vaccine deployment is very timely. But before we get on to the speakers, let me start off by with some housekeeping. I would ask everyone to please mute your mics and turn off your videos as we progress through. For questions for our panelists, there'll be plenty of time towards the end. Please use the chat box so we can pick those up, and we'll endeavour to have a valuable discussion after we hear our speakers. Second, I'd like to quickly run through the agenda of today. We're going to start with opening remarks from my colleague, the Chief of the Health Sector Group, Patrick Oasay. We then have two fascinating speakers on the key subject, who I will be introducing later. First, we have some discussion on the lessons of the past roles of civil society organizations in vaccine deployment. And then second speaker will be covering some of the governance issues of civil society collaboration for vaccine rollout. So let me start off today by welcoming my colleague, Patrick Oasay, who's Health Sector Group Chief here in the Asian Development Bank, speaking and joining us from Nairobi. We have a very global set of speakers today. So Patrick, perhaps you could kick us off by sharing a little bit about where Asian Development Bank is in our vaccine and COVID-19 support efforts. Thank you, Patrick. Over to you.
Thank you very much, Chris, and welcome to all participants for this very important session. For us as ADB, COVID has had a very negative impact in our region, in Asia and the Pacific. And as the largest, the second largest development bank in the world and the largest in Asia, over the past 60 years, we've invested significantly in supporting countries to grow economically. And COVID-19 is reversing many years of gains that countries have made just in 1 year, what the gains have been made over the last 60 years. And so we take this very seriously. And we've done two big initiatives. Last year, in April, we allocated $20 billion to support countries to respond to COVID through a variety of mechanisms, supporting the vulnerable, building the testing capacity, and supporting the marginalized in society to be able to live. And then in December, once vaccines started to become available, we allocated $9 billion to support our developing member countries. This is the largest allocation of any development bank. The World Bank allocated $12 billion for the whole world, And for us, 9 billion just for Asia and the Pacific. So we have significant resources that we are making available for countries to combat COVID-19 and to make vaccines available. So there are 5 areas that I would just like to share with you where I think that are entry points for civil society organizations and NGOs. The first is that many countries in our region have gone through a very elaborate process to determine who is going to be accessible, who is going to access the vaccines in order of priorities, starting with healthcare workers, because they are exposed to the virus every day as they take care of those who are sick, and then followed by the elderly and people with pre-existing conditions, and then going downwards in society. Now, the biggest challenge is that this access criteria is something that countries are discussing and coming up with. Now, the question is, to what extent will this criteria be implemented? And I think that this is up to the civil society organizations and NGOs to help us ensure that any criteria that has been agreed by the task force, the COVID-19 vaccination task force in any country is actually being adhered to. Because the last thing we want is a situation whereby only certain people getting vaccines and the vulnerable are being left behind. The second issue that we should think about, where there's an excellent opportunity and entry point for NGOs, is that most vaccines currently are 2-dose vaccines, which means that whoever gets the first dose 3 weeks later or 4 weeks later should come for the second dose of the same vaccine, not a different vaccine, the same dose of the same vaccine to ensure that they get significant or full immunity. Now, this is where the challenge comes. Many people might be able to come for the first dose, and then coming for the second dose, there might be significant barriers. Some might be transport barriers, some might be the family barriers. There could be significant barriers. And to the extent that the governments can involve civil society to support the follow-up actions, whereby you identify these are the people who came for the first dose, and let's trace them and track them if they've not come back for the second dose to ensure that there's completeness of vaccination. This is a mammoth undertaking because in many countries, and I'll just take 2 countries as examples. In Indonesia, the government has a very ambitious plan to vaccinate up to 181 million people in a period of 14 months. In the Philippines, up to 70 million people in a period of about 18 months. This is very, very, very ambitious and requires more than the Ministry of Health to deliver on these ambitious targets. And I think that civil society organizations and NGOs have an excellent role to play in mobilizing the population, ensuring that people come for the first dose and also they come back for the second dose. And if they don't come back for the second dose, identifying what are the barriers and how we can support the population to come back for the second dose. Third is that we also have some people in society who may not be able to come to the clinic, particularly in countries that are approaching this through hospital-based vaccination. We have the elderly who might not be able to go to medical facilities. We have people who are disabled who might not be able to go to facilities. So I think that the NGOs can provide a bridge between what's going on in the hospital and what's going on in the community, and urging and working with primary care facilities to actually take vaccination to the people. Instead of, some people can go to the clinic, but others, we need to go to where they are. The fourth one is on monitoring adverse events. Usually, after every vaccine, a few people, the majority of the people just feel pain at the injection site, but a few people might get complications. Now, given the millions of people that I've just talked about, that's very difficult for the government to keep an eye on everyone. You need a network of civil society organizations, community-based organizations, NGOs, to be able to lead this effort and see how this can happen. In Indonesia and Philippines, for instance, we have some NGOs that play a very significant role in disaster assistance. They could be mobilized to support the countries in reaching out and also educating people about vaccines. There are many, many people who still don't think that the vaccines are safe for a variety of reasons, feeling that it was rushed in terms of clinical trials, and that maybe they want to see what happens to other people first. I think this is an important role to explain to them that what has happened in vaccines, COVID vaccine, is that the red tape is what was reduced. Everything that has happened in COVID vaccines is what has happened to other vaccines. In fact, in COVID vaccines, more people have enrolled in the clinical trials than ordinary vaccines. For example, in most vaccines, the people who enrolled for clinical trials were usually around 8,000 to 10,000. In COVID vaccines, in some studies, it's up to 40,000 to 60,000 people. It's the vaccine that has been most, but that had the most enrollments of any vaccines. But people don't understand. They think that because the timeline was very short, less than 1 year, that these vaccines were rushed. And then the last one is looking at issues around communication. I think communication can take different channels. There's communication that can be done by the national government through televisions, public service announcement through radio, but there's also communication at the community level, at the grassroots level. And this is the most important communication, because then the leaders and the civil society members have the opportunity to explain further why this is important for economic growth, important to protect public health, and important at the individual level. So I'll stop there and saying that this is a great opportunity to collaborate, engage, and provide the leadership at the community level to ensure that ADB can succeed in this bold agenda of vaccinating millions and millions of people in one country or across the region in a very short period of time. So welcome, and we look forward to a very positive and an interesting discussion. Thank you very much, and over to you, Chris.
Thank you, Patrick, for kicking us off there with those opening remarks. As you say, plenty of opportunities for civil society organizations to participate in what you describe as a mammoth task, both in terms of health challenges and logistics. I particularly like the confirmation from you as a health specialist that you feel that despite the tremendous results very rapidly with the vaccines, that they have gone through a very thorough and trial period. I think that that is important to many people. But I'm sure our two speakers will also be sharing a lot of their expertise also in terms of their experience, both directly working with civil society organizations and in the monitoring and evaluation of their activities. So let me move on to our first keynote speaker, Miss Jada Tutuan, who has over 10 years of working experience in international development. She has a lot of experience across a range of things, but is currently focusing on monitoring, evaluation, and the learning that we get in development from these monitoring activities. She currently works with an organization, a global organization called ITAT, which has a very simple mission, and that is to provide safe monitoring, evaluation, and learning services to make international development more effective. Jada herself is a sectoral expert in health. She has specific expertise in vaccines, health financing, in strategizing of health organizational issues and development effectiveness. So I welcome Jada here today to share some of her experience, particularly in a recent monitoring and evaluation efforts of civil society working with Gavi. So over to you,
Thank you very much, Chris. And hi, everyone. Good morning, good afternoon, and good evening. Yeah, great, thank you. So firstly and foremost, thank you so much for inviting me today to speak about this so important topic, about the role of civil societies in promoting equity, governance, and good governance in COVID-19 vaccine deployment. Thank you so much. So next slide, please. Today, I will be talking about 5 key things. So about the role of civil society organizations and communities in health systems, presenting a framework that goes beyond the traditional WHO 6 building block approach to health systems. Then I will be introducing the rationale for integrating civil society organizations and communities in COVID-19 response, with a focus in particular on immunization. Then I will be describing different roles that CSOs and communities can and should play in immunization. Then I will, as Chris mentioned, present some evidence of positive contribution of civil society to immunization outcomes from an evaluation I carried out 2 or 3 years ago for Gavi, the Vaccine Alliance, on their approach to support civil societies. And then I will be, and also from the broader literature. And then I will be drawing some conclusions and implications. Next slide, please. So the role of civil society organizations and communities in health systems. Many of you will be familiar with the 6 building blocks of health systems by WHO. These are service delivery, health workforce, information, medical products and technologies, financing, and leadership and governance. While these 6 building blocks provide a very useful framework for strengthening functions within the formal health sector, they also sometimes miss out kind of services and actions that happen outside the formal sector. So often these 6 building blocks are now used to describe health systems and guiding investment in health system strengthening. However, WHO itself has recognized that the framework is a bit too static as it is to help navigate the complexities of health systems. In practice, as it was already mentioned today, while many services are provided within the formal health systems, so at health facilities such as hospitals and health centers, a multitude of other services such as preliminary screenings, preventive services, and basic treatments are provided outside the formal facilities. And also activities and communities that community can carry out vis-a-vis immunization, for example, include advocacy, education, governance, fundraising, and lots of other support services. So community organizations, societal partnerships, household production of health and information are often not recognized within the health systems if we use this traditional framework. Therefore, I argue that there is a need for going beyond the 6 building blocks, and I will provide a framework to do that. There is this need in order for policymakers to recognize, prioritize, and invest resources that can really strengthen the health systems in an inclusive way and promote health for all and achieve global ambitious goals. Next slide, please. So yeah, I would like to introduce this framework that was actually presented and introduced by Sachs and other colleagues in an article called Beyond the Building Blocks, Integrating Community Roles into Health Systems Framework to Achieve Health for All. As we can see in this framework, in this diagram here, healthy people, healthy communities depend on 3 key things. First of all, the delivery of high quality, evidence-based service, then household production of health, and social determinants of health. And as we can see in this framework, with the kind of blue boxes, civil society and communities are much more present than we would have otherwise thought. First of all, they are present in service delivery. In recent years, there is a growing amount of evidence around the essential values of community-based services. for example, in nutrition, immunization, child health, maternal health, and other areas. Then, of course, communities and civil society are present in the health workforce. So the health workforce is not only made up of facility-based health workers, but also of community health workers and community health volunteers. As shown in this framework, community organizations on the right-hand side are not only essential, are an essential element of the system in at least two key ways. So first of all, communities can play a critical role in advancing the determinants of health through service delivery and health workforce. And also, community organizations are the practical construct through which one can engage communities at scale. Next slide, please. So, what is the rationale for integrating civil society organizations and communities in COVID-19 response? So the current situation is that the current global COVID-19 response face serious growing challenges. First of all, there is a sense of increasing sense of pandemic fatigue that can cause lower risk perception and reduce trust in the government response. So this declining risk perception means that people feel maybe that they're not threatened, that maybe their friends or family are, or certain categories of groups are, but not themselves. There are people believing that some categories of people are not affected by COVID-19, such as, for example, as in young people not being affected. And there are some beliefs even around the fact that the pandemic has ended or COVID-19 doesn't exist. This is also compounded globally by a low sense of self-efficacy, meaning that studies show that half of the population believe that they're not confident in their ability to fight and prevent COVID-19. So these being the challenges, these challenges are present, of course, in high-income countries as well, but in lower and middle-income countries are compounded by weaker health systems and supply chains, and also higher barriers to access, as Patrick mentioned before. So in response to these challenges, integrating civil society is not only the right thing to do from a value-based perspective or an ethical standpoint. It is really the right thing to do from a public health perspective if we want to really put an end to this pandemic. As including civil society organizations and communities, as I will argue in the presentation, is really critical to increase the effectiveness of the response, and in particular of the vaccine deployment, in at least 4 ways. So first of all, this will help reach the hard to reach and supplement weak formal systems, especially in fragile and conflict affected areas. It is also bound to increase the demand for vaccination, including by fighting vaccine hesitancy or even anti-vaccine movements. It is also bound to increase the equity, gender equality, and human rights integration in the response, which in itself it's meant to increase the effectiveness of the response. And finally, as Vina, I am sure, will expand on in his presentation, this will encourage transparency, accountability, and good governance. Next slide, please. So on to the roles that civil society organizations and communities can play in the immunization process. So first of all, the perhaps most widely recognized role that civil society can play is one of addressing demand-related barriers, including, as I mentioned before, vaccine hesitancy. This can be done, for example, through advocacy and communication at community level to fight the so-called infodemic and misconceptions about the vaccine or the virus. So as WHO and other partners have already warned, in the current situation, strong risk communication and community engagement is really needed to accompany the vaccine rollout in order to anticipate and fight rumors and misconceptions. Next slide, please. So beyond this role of increasing demand generation, there are multitude of other roles that civil society can play and should play and do play in immunization. So, for example, a role of resource mobilization and advocating for equitable access within and between countries. So given the risk of inequitable access of COVID-19 related biomedical tools, such as including vaccines, civil society really have a paramount role to play here in policy and strategy around allocation and resource mobilization. Another key function that Vinay will expand on in his presentation is that of encouraging transparency, accountability, and good governance. This can be done, for example, by playing a watchdog role vis-à-vis national governments, donors, and global health actors such as COVAX. So while fair and equitable access to vaccines globally is the only way to mitigate and put an end to this pandemic, equitable access cannot be established behind closed doors or without a fair balance of stakeholders' views at the table. Next slide, please. So finally, another key role that civil societies and communities can play and do play in immunization is one of implementing immunization programs. And this complements public service, formal kind of public service delivery. And this is particularly important to reach the hard to reach in fragile and conflict affected areas. Next slide, please. So onto the evidence. What evidence is there of positive contribution of civil societies to immunization outcomes? So as I mentioned before, a few years ago, ITAD, the company I work for, conducted an evaluation for Gavi, the Vaccine Alliance. This evaluation focused on Gavi's support to civil society organizations, and it was twofold. It focused on the governance arrangements and Gavi's support to so-called CSO platforms at country level for them to engage with interagency coordinating committee and governance mechanism at country level. And also the evaluation focused on some small HSS, so assistance strengthening grants that were given to civil society organizations for them to involve in immunization-related activities at country level. So what did we find? With the caveat that we could only measure contribution through a full contribution analysis in 2 countries, and for a limited period of implementation, given some implementations delays, we found that civil society organizations' activities at the community level were thought to have positively contributed to strengthen demand for immunization. These countries were Ghana and Mali. So in Ghana and Mali, civil society organizations worked on sensitize and educate communities on the benefits of immunization through a range of activities. Stakeholders noted that the added values of engaging civil society organizations to implement such activities had been one of kind of integrating local knowledge and of various religious and cultural related barriers, and also their ability to convene large groups of people at community level and targeting more localized groups in order to disseminate messages to tackle barriers to demand and access to immunization services. So stakeholders viewed these activities as absolutely necessary in order to improve immunization coverage, particularly given that they were being implemented in low-performing and hard-to-reach or unsafe areas of the countries. To a more limited extent, CSO's activities through the Gavi HSS support, such as, for example, addressing supply-side issues, training vaccinators or community health workers, were also thought to have improved the quality of immunization services delivered. Next slide, please. So beyond this work that ITA did a couple of years ago, actually, like when one reviews the literature, the contribution of civil society organizations and community to immunization outcomes is currently an under-researched topic, unfortunately. This is also pointed out in a scoping study carried out by 3IE in 2015 on engaging communities for increasing immunization coverage. Then they reviews the literature out there. However, despite this kind of lack of evaluations in contribution, evidence of contribution at that higher level, there is good evidence that interventions that are co-managed with communities and civil society are really likely to be more successful for the reasons I just mentioned earlier in the presentation. And civil society can really play a multitude of role in the immunization cycle. However, as ever, no one-size-fits-all approach can be implemented, and contextual factors really should inform the design of every community engagement approach. Next slide, please. So to conclude, civil society organizations and communities really have a crucial role to play in COVID-19 vaccine deployment. And not only they can be used to fight vaccine hesitancy or anti-vaccine movement and generating demand, they also have a crucial role to play really to ensure that the chances that the allocation of vaccine is equitable within and between countries, or as equitable as possible, to ensure that the hard-to-reach populations are not left behind, especially in fragile and conflict-affected areas, and to ensure that governments and international actors such as COVAX are scrutinized and really held to account. This is not only a moral imperative, but it's also like a way to maximize the efficiency and effectiveness of these efforts and to obtain the best possible public health outcomes in face of all the challenges we have seen in the presentation and earlier, like about fragile systems, pandemic fatigue, vaccine hesitancy, and so on. While there is a paucity of evidence in this area, as I mentioned, about the actual contribution of civil society to increase immunization outcomes, there is no doubt that really involving them is paramount to increase the effectiveness and inclusiveness of any intervention, and in particular of vaccine campaigns. So programs and interventions related to the vaccine rollout should at the same time meaningfully engage communities and civil society, and also help to generate evidence so we can all learn from their experience going forward. Yeah, the next slide is just a few resources if you want to find out more. Otherwise, yeah, this is the end of my presentation. Thank you so much.
Thank you very much, Jada, for some very rich insights there that started with you re-emphasizing something Patrick started with, the challenge that we have in Asia and the Pacific of ensuring that we have healthy people and healthy communities with evidence that you cited and your experience and arguments for the role of civil society in the which traditionally has worked closely with communities. I think that emphasizes the opportunities for and the necessity, as you say, for civil society organizations to be involved. You mentioned the evidence is there, and the paramount need to effectively work with communities, re-emphasizing that a couple of times. So thank you for those insights, and I'm sure we'll come back with some questions related to your presentation. I'd now like to go to our second and final speaker before we open it up for questions. And I note that there's not a lot of questions yet coming into the chat, so please do give some views or specific questions to our panelists as you're listening. So I would like to now introduce Mr. Vinay Bhagava, who is a Chief Technical Advisor of the International NGO Partnerships for Transparency, or PTF for short. PTF is an innovative civil society, supports innovative civil society led initiatives to improve governance and development effectiveness. It's a global organization, a network of dedicated professionals around the world. And it's currently supporting grassroots CSOs in India, Ghana, Uganda, Argentina, and Zambia to complement government efforts for implementing and for ensuring the governance of the COVID-19 response and recovery. And I think that link to the grassroots organizations is something that, as Jada mentioned, is an important area that civil society works in. Vinay is an old friend of ADB. He's worked as a resource person, as a consultant for many years, principally in the fields of governance, impact evaluation, and civic engagement. He's an author of an ADB upcoming governance brief on the subject of this webinar today, engaging civil society organizations to enhance the effectiveness of COVID-19 response in Asia and Pacific. And we'll certainly be sharing that shortly to all the participants here today. He's also well known here in the Philippines as a former country director of the World Bank here. So Vinay, could I request that you close off our presentations for today before we go into a panel discussion? Thank you.
Okay, thank you, Chris. And doing a sound check. Can you hear me all right?
Loud and clear.
Okay, thank you very much. Let me start by thanking ADB for this opportunity to share with you ideas on how to ensure good governance in vaccine deployment. Here, what I mean by good governance is that it is evident when vaccination covers target groups, it is equitable, it is safe, it is transparent, it is accountable, and it is free of corruption. Next slide, please. Now, there are many governance problems that may arise during the vaccine deployment. I'm not saying that they all will happen in one place all the time, but they are illustrative of the kind of problems that would arise. This has already been mentioned by Patrick and Giada in different ways, but there might be inadequate coverage of marginalized or vulnerable groups. People may get vaccine out of turn. Their information on vaccine availability may be hard to get and not easily accessible, and people wonder when it will be available, where it will be available, how it will be available, and what type of vaccine will be available. There will be rumors, there will be misinformation, which will undermine confidence in vaccines. There may be inadequate adverse reaction monitoring. There may be corruption and lack of transparency, and there are even reports of fake vaccines being introduced in the supply chain. And there are also incidents where even though many governments are making vaccine available for free, there may be people demanding bribes and extra payments. Next slide, please. Now, governments and donors such as ADB are aware of these governance risks and problems and are taking actions to mitigate them. However, as you know, history and data on development effectiveness and anti-corruption tells us that it would not be wise to rely on government actions alone. They take these actions in good faith, but they are never sufficient. They are necessary, but never sufficient in ensuring good governance. So we cannot just trust the government to make sure that there is good governance in vaccine deployment. This is not something which is my personal view. As you know, Agenda 2030 acknowledges that the Sustainable Development Goals cannot be achieved by governments alone. And it calls for partnership between the governments, donors, civil society, and private sector. This basic premise that governments cannot do it alone and a partnership with civil society and private sector is essential is even more urgent in the pandemic, given the unprecedented scale and speed of effort required. Now, Jada's presentation has shown that CSOs and communities have a crucial role to play, and involving them can increase effectiveness and inclusiveness of any vaccination campaign. I have rearranged on the slide, as you see, the roles she had outlined for CSOs, which are very much converging with the roles that Patrick outlined in terms of what CSOs can bring to improve the governance and equity of vaccination deployment. And I have essentially grouped these roles into two major roles. One, as service providers. Civil society organizations around the world provide a number of services to the communities, and they can draw on this role to help implement immunization programs and to help address demand-related barriers as well as vaccine hesitancy, and do, for example, what Patrick highlighted, that there are many people who are willing to take vaccine but are not able to get to the vaccination centers or navigate the technological requirements of registering for the vaccination. Civil society organization as service providers in hard to reach communities can help play that role. The second role is to serve as advocates for equity and good governance, as well as watchdogs, to make sure that we don't not only trust the governments and donors to do the right thing, but we verify that they do the right things. Not only trust, but verify. Well-known cliche about the role of state and the role of civil society. Now, one prime example of the advocacy roles that civil society organization plays is provided by COVAX, which Jada mentioned. They, civil society organizations, way back in July 2020, wrote a letter to COVAX saying that their decision-making processes are not transparent and they are not participatory. Even though COVAX was heavily supported during its formative phase through civil society advocacy. Fortunately, these COVAX listened, and 10 civil society organizations were recruited in August and finally appointed in October 2020 with the mandate to foster the necessary political and community engagement to try to ensure equity and good governance in access and delivery of vaccines. So the roles that civil society organizations play as advocates and as watchdogs are extremely important. I will not focus on that too much on this in this seminar, because many times to play the role of advocacy and watchdogs, the civil society organizations have to work from outside of the government collaboration and have to do an arm's length relationship. The focus of rest of my presentation will be on what the civil society organizations can do and how they can do it to complement the government efforts and donor efforts as service providers, particularly at the community level. Now, next slide, please. There are 5 areas where CSO community engagement is extremely important. Next slide, please. First is, of course, to alleviate the community hesitancy. Let me say that these, please go ahead and bring in all the 5 points. You will see that there is a lot of convergence between these 5 areas for CSO engagement that you see on the slide and the areas which were highlighted by Patrick as well as by Jada. This is no coincidence. I think there is quite a bit of consensus about what the civil society organizations can do to collaborate with government agencies and donors to improve the equity and governance and coverage in the vaccine deployment. These 5 areas, like alleviate community hesitancy, distribute materials, expand service delivery, enhance integrity in procurement, and organize participatory and budgeting and audit, are well documented in the research on CSO engagement in development programs. We have heard a lot from Jada as well as from Patrick about the first 3, about alleviating community hesitancy, distributing materials, and expanding service delivery. The last 2, which relate to enhancing good governance, are not too much talked about, but there is quite a large amount of body of practice and evidence how civil society organizations can improve the integrity in procurement, which, as you know, represents a bulk of the expenditures on COVID-19 health services as well as vaccine deployment, and how they can work with the government accountability institutions such as Supreme Audit institutions, ombudsperson, and anti-corruption agencies and budget authorities through participatory methods. So these are the 5 areas for civil society organizations that are described more fully in the governance brief that Chris mentioned, and that will be available in about 2 weeks. And if you would like to, I'm sure you can easily obtain it in about 2 weeks when it is published by the Asian Development Bank. Now, the CSO engagement is not just a good principle, but is actually being practiced in different countries in different ways. I would like to share with you example of 4 countries, how they are approaching civil society engagement in vaccine deployment. This information is evolving every day. And at the moment, I have been able to review the national vaccine deployment programs and stakeholder engagement programs in Mongolia, India, Bangladesh, and the Philippines. Now, Mongolia is, in my view, at the moment represents the good practice. What they're doing is they're taking a part of the money which has been mobilized from donors such as the World Bank, and they are actually going to use that money and allocate a part of it to contract civil society organizations in complementing the government services in several areas. I repeat, Mongolia will actually take the money it is borrowing from the World Bank and allocate it to contract with civil society organizations all over the country to provide certain services to complement the government programs. What kind of services? Profiling of vulnerable and marginalized groups and registering them. That's one area. Another area is they will organize focus group discussions and meetings to facilitate community compliance with various guidelines of the health authorities and overcome community hesitancy. Another service which the CSOs will provide is they will mobilize communities to support the government vaccination drive. Another area the civil society organizations will engage in is to monitor the government service delivery and identify the gaps in real time and provide the feedback and share the feedback with the implementing authorities. And finally, the civil society organizations will disclose, will help with the, make sure that the information is disclosed in a timely and adequate manner. All of these services CSOs will do under contract with the government, where government will pay them to do this. And this is the good practice, because the CSOs cannot work for free. They need money to operate, and many of them are willing to operate. I must say that there are many CSOs which are in Mongolia are engaged in advocacy and in watchdog functions, and they will not be contracted by the government, and they don't want to be contracted by the governments. But the civil society sector is big enough to accommodate both types of CSOs. On Mongolia, I should say that in addition to all this, the government in its stakeholder engagement plan says that it is open to arm's length third-party monitoring by civil society organizations to hold it accountable. So as I said, this is the good practice, if not the best practice. Now let me go take you to India. India has a very robust civil society sector, though some of its operational freedom is being restricted during the COVID, but nevertheless, it has a robust civil society sector. When the COVID-19 happened last year, the government of India rolled out a welcome act. Despite its reservations about civil society, it rolled out a welcome act by writing to more than 76,000 CSOs, all the CSOs in India, to say, please, you are welcome to help complement the government's efforts to fight the pandemic. We welcome you, we will enable you, we want your cooperation. They didn't put any money into it, but at least that welcome mat and a letter going out all over India opened the doors and created an enabling environment for civil society organizations at the community level. When they were rolling out the vaccination drive, the government of India once again issued a welcome mat to civil society organizations, asking them to help alleviate the community hesitancy and to monitor service delivery, help people register, and overall increase the equity and coverage of the vaccination drive. They also said that we welcome third-party monitoring by civil society organizations on government performance. So this was a good practice in a different way for a large program, world's largest vaccination program in the world. Now let me take you to Bangladesh. Bangladesh also has a robust civil society organizations, and the Philippines, which has a similar things. Both of those are receiving about $500 million each from the World Bank. And if you add the ADB money, almost $1 billion Philippines is receiving for vaccine deployment. But their national vaccine deployment program mentions civil society organizations only in the passing. They are mentioned, described very heavily in terms of consultation, how they were consulted during the preparation of the plan. But when it comes to what exactly the government will welcome the civil society to do, it is almost silent. Similar situation in Bangladesh. So this seems like a missed opportunity in both the cases. There may be information which I'm not aware of, but as far as I am able to tell through a review of their national vaccine deployment plans and the stakeholder engagement plans, there is no explicit roles specified in them for civil society organizations. There is no welcome mat, and there is no money allocated in Bangladesh or the Philippines for civil society organizations. So this is a choice the countries are making. Some are seizing the opportunity, others are not doing that. Now let me end by reminding ourselves why investing in expansion of CSO engagement is good policy. We know that equitable and effective vaccination can save lives and livelihoods and enable reopening of economies. We also want to know at the same time what happened to the trillions of dollars of public money spent on pandemic response, including billions, hundreds of billions from the development banks. We want to be assured that the governments have spent this money with integrity. Now, governments alone, as I said before, can neither do both of these things, nor should we trust them to do them on their own. What are the two things? One, to ensure equity and effectiveness in vaccine deployment. And second, be accountable and spend the money with integrity in the COVID-19 and vaccination programs. Now, civil society organizations can complement the government efforts and to do the vaccination effectively and equitably, as has been discussed by all the speakers so far. And then they can also, and this is the element I would like to highlight, they can also monitor government actions and hold them accountable to promote equity and good governance, and not just rely on a blind trust that the governments will do it automatically. To do this, twin roles as service provider and as advocates and watchdogs, the civil society organizations need to be welcomed and funded by allocating a fraction of the money which is being spent on pandemic response. As we know, trillions of dollars are being spent. So a few $100 million is spent to resource the civil society organizations to do their twin roles of service providers and to hold the government accountable will be money well spent. This is what I would argue and say that. There is ample evidence and experience to give us confidence that doing this kind of civil society engagement will improve equity, safety, coverage, transparency, and accountability and control of corruption, as well as improve public trust in the COVID-19 vaccination programs, and will save lives and will allow faster opening of these economies. With that as our hope for 2021, I would like to end my presentation. Thank you, Chris. Over to you.
Thank you, Vinay. And thank you also in particular for putting some of the practical aspects of what's happening in the four countries, the different approaches by governments in Mongolia, India, Bangladesh and Philippines, emphasizing, as you did, the need for partnerships, whether it's civil society with government or with the private sector. That came across very, very clearly, and your simple but very, very direct way of differentiating between the roles of civil society as a service provider and also as advocacy groups, and that fitted very nicely with our two previous speakers. Thank you for that. I have been monitoring together with the team our chat box. We haven't been getting many questions or comments coming in, so we've still got another 20 minutes. So please don't be shy. Any burning questions, as we have these experts here. Perhaps I will start off by coming back to Patrick and maybe Jada. You both talked a little bit about COVAX or the Vaccination Alliance. I think one of the things that a lot of us don't really put into perspective is that these organizations, certainly the Gavi, the Vaccine Alliance has been around for decades. It's a long-term organization, part of the WHO. Perhaps I could ask you, Patrick, as a health specialist, and then Jada, perhaps to give a little bit more description about their roles and some of the challenges that they are encountering, or the bottlenecks in the current rollout, which of course is exceptionally large and needs to be both very widespread and inclusive for us all to benefit from it. So perhaps a little bit deeper dive into the role historically and the relationship with civil society organizations. Patrick, would you like to share a little on that?
Yeah, so I'll come briefly, and Vinay can also complement that. So the challenge that that the world was facing is that we have rich countries that have invested in some of the COVID vaccines. That there was a race to obtain a vaccine, and that mostly it will be used by the rich countries, and therefore COVAX was established to ensure that vaccines are available for low-income countries, and they did fundraising to so that they could support research of about 11 vaccines. So basically, they had direct investment in a few vaccines, AstraZeneca, for example, being one of them, and so they are supporting 92 countries, which are countries that are basically getting the vaccines for free to ensure equity. Now, the challenge is that COVAX is getting vaccines from some of their investments and also some from other pharmaceuticals. And the plan is to provide vaccines initially for healthcare workers and progressively targeting the vulnerable groups until they reach, and then the general population until they reach 20% of those that are vulnerable. Now, the task is mammoth because you just can imagine getting vaccines, distributing vaccines across 92 low-income countries, the challenge of transportation to the countries, the challenges of once they get into the country, how do you deploy it across the various countries? Some countries are difficult to reach, like say the Pacific Island nations. It's very difficult to reach some of the countries, particularly at a time when also there's travel restrictions. So it's been a major challenge for COVAX, but it's getting a lot of support. UNICEF is involved, WHO is involved, and governments themselves are involved in terms of providing support to ensure that this happens. Of course, the challenge is that many countries have come up with an allocation criteria that should be used. And what we are seeing is that in some countries, there's a lot of vaccine hesitancy, whereby the vaccines arrive in a country, they're made available to the healthcare workers, and the healthcare workers are not keen to be vaccinated because of a variety of reasons. And then it's opened up to the second category of people, and then there's also still challenges. I'm currently in Kenya here, and one of the challenges that the government is facing is that the healthcare workers were not coming out in large numbers, and therefore they opened it up to the other categories, and then they opened it up to anybody who wanted a vaccine to go and get a vaccine to ensure that they don't expire, because as they were telling me that some of them are expiring by the end of May. And so to the extent by which people can be educated, and we've seen hesitancy across some of our developing member countries. For instance, in India, they had the same situation whereby the healthcare workers were not as keen to get the vaccine, but as more and more people got the vaccine, people started seeing that, oh, if other people are getting it, I will also go and get it. It's actually safe. They just wanted proof that, my friend has gotten it and they're okay, a week later. And so on. So there's significant education that is required. to be able for people to be comfortable that that vaccines are safe. There are also logistical barriers. In most countries, they've started with major cities, and then getting out to the rural areas is very difficult. And the logistical challenges in terms of cold chain requirements, the cold chain that's been established, and also once you're able to move it, countries able to move it from the capital city to the rural areas, is then monitoring the people who are taking vaccines to identify if anybody is having any adverse events. So it's I mean, this is just started about 2 months ago, and I would say that COVAX has done a good job in terms of trying to ensure that they work with the countries that have to be ready to be able to get the vaccine, because they don't want the vaccine to arrive in a country and the vaccines are not they are not being used, or they cannot be deployed. So that's negotiations with the country to ensure that they're ready is a big issue. One of the biggest challenges that countries are facing is the healthcare workers. Some countries don't have a lot of healthcare workers, and therefore, to the extent that they have to think out of the box on how to vaccinate hundreds of millions of people for big countries, but even for smaller countries, the capacity can be very limited. And I'll give one specific example in our region. In Papua New Guinea, this is for the Pacific. Immediately COVID started, they shut down their borders, and everything was under control for months, almost a year, when there was very limited spread. But now, when countries were beginning to open, challenges started. Papua New Guinea, population 9 million people, only 500 doctors, 4,000 nurses. The disease is now spreading, and there's a lot of panic in the country on how how it can be supported. Australia just donated 8,000 vaccines to target those who are at risk, and that's is not enough. So there are many challenges as we move forward with the second surge of infections, and also with the new strains of the virus. Lots of challenges as we go forward. Over to you, Chris.
Okay, thank you, Patrick, and yeah, that reminds me of something that Jada said in terms of it's very contextualized what's happening across the region in countries. The examples that Vinay also gave in terms of the policy of the countries. So it really has to be very specific. So let me, it's nice to see there's a little bit of chat going on. Let me try and take a couple of the themes which are appearing there in terms of experience, noting that any experience needs to be contextualized, possibly for Jada and also Vinay. Jada, in respect to some of the challenges that we're seeing now, you've obviously been monitoring and evaluating vaccination programs for quite some time. So what can be learnt from previous programs that can help us now? And you specifically, and it's come up a few times in terms of the vulnerable, the poor, the hard to reach, where can civil society come in? And Vinay, there's some questions linked to that in terms of where governments choose to engage. And there's a specific question on experiences of MDBs and I think multilateral development banks, that is. I think you mentioned that up in Mongolia, there are specific components to a World Bank project funding civil society organizations. Perhaps you could give a little bit more of a description on that, of what you and why you feel it's good practice. Perhaps Jada first, please.
Okay, thank you. Thank you very much, Chris. And first of all, I also wanted to respond to your earlier point made earlier about Gavi in general, Gavi, the Vaccine Alliance. Right. So yeah, this is an alliance between various partners, including, of course, WHO, UNICEF, World Bank, Bill and Melinda Gates Foundation, and they receive money from these and other donors. And then like what they do basically is to help countries around the world to purchase vaccines and introduce and roll out new and existing vaccines at a lower cost or no cost, depending on kind of the status of the country, including like transition plans when a country moves to middle income country, etc. So they play a really important role, and they've done so in the last 20 years probably. And they're also quite good at recognizing the role of civil society organizations. So they have a vast CSO constituency made up of at least, I think, 4,000 civil society organizations with kind of a elaborated governance model. They have civil society representatives on their board. And they engage with civil society in many different ways. So I was mentioning briefly in my presentation, they support a civil society platform in a number of countries around the world for them in turn to engage in governance in those countries and play all these important functions Vinay mentioned in his presentation. And then they have also health system strengthening type of grants, supporting civil society in service delivery, let's say. So yeah, and evidence shows, of course, that their role is particularly important to reach the hard to reach in fragile and conflict-affected areas, for example. Imagine, yeah, like where I don't know, like in countries with a lot of internally displaced people, or countries that suffer from conflict and war, but also in general, just countries with weaker health systems. I think, yeah, imagine like Patrick and others mentioned before about the barriers of sometimes having to travel very, very far to receive a vaccination and maybe coming back for a second dose. Yeah, that's something maybe many people are not in a position to do. So like if these services can perhaps being offered closer, like in the community, that's of course a big plus. Yeah, I don't know if I've answered your question or there was anything else.
Okay, yeah, thank you for picking up the earlier one as well. So Vinay, there's quite a lot of interest about what works, and I know it's $1 million question, but we all know across such a diverse region like Asia Pacific, then each country is unique. Situations are unique. Things do need to be contextualized. But we did hear of some specific commonalities in terms of hard to reach, vaccine hesitancy, strengthening demand, immunization service for vaccines by CSOs, together with the countries where there exists a conducive environment, the role of civil society in advocacy, which isn't always there. Perhaps you would like to share a little bit more, Vinay, on an example with external funding that the government has used and engaging CSOs in the vaccine rollout to the pandemic, please.
Certainly, Chris. I think as we, yeah, so wanted to make sure my mic is unmuted. You can hear me all right? Yeah. Okay.
Yes. Yep.
Thanks. Yeah, I think it is. First of all, let me say, as the obvious that very difficult to have specific precedents about what the CSO should do in COVID-19 vaccination, because it has never been done before. So I think at best what we have are only pointers from other different interventions in which CSOs have engaged. So I think how the governments are approaching civil society engagement in COVID-19 responses and vaccination is also a very evolving day-to-day thing, because information to the public about what role civil society organizations are being asked to play and how the governments are soliciting them is only coming on a daily basis. These four examples I mentioned have just been publicly documented in the past few weeks. And there are new ones coming every day. So I think it's hard to give you many more examples, but one thing is clear that each country will have to define its own approach towards civil society engagement, and that I respect, and we should all encourage that. If they do a deliberate discussion about the role civil society organizations will play and come to a decision, I think that's the way to go forward. Donors such as ADB or the World Bank can play only a very limited role. They can only encourage the governments to ask that question and debate it, but I think they can set examples, which, like, for example, the ADB is doing. It has supported a technical assistance grant from its own money, $2 million, to demonstrate how civil society organizations can engage at country level, at community level, to make a difference. So I think the donors can do that role. And if the government wants, then they have policies which definitely allow them to allocate a part of their funding to civil society engagement, as has been the case in Mongolia. Obviously, government of India didn't want and didn't ask them for allocating that money. And in the Philippines, as far as I can tell, the government has not asked the donors to allocate a part of the $1 billion that they are receiving for vaccine deployment program to directly fund civil society organizations. Of course, if you ask the government of Philippines, will you welcome civil society organizations to complement your role? They will say yes, 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 of course. But there is a difference between that and rolling out a welcome mat and providing money on the table. So I hope that that puts these in context. Of course, there are state of civil society in different countries varies. And there was a one question about there are many countries where the civil society activism and a space is not comparable to what it is in the Philippines or in Mongolia or in India or in Bangladesh. Obviously, in those contexts, the role of civil society and what it can do will be somewhat limited compared to these other countries. So I hope I've addressed some of the questions, but I'm happy to come back and add more as the questions come forward.
Thank you, Vinay. You added an additional dimension of complexities and the contextualizing not only the problems with the vaccine in the countries, but also the environment for civic engagement, which, as we know, does vary from country to country. So I'm conscious of time, and we are coming towards 7 o'clock here in Manila, and I hope to end very shortly. I do recognize that there are a few more comments and some discussions in the chat. We will be in touch with you if there's any specific replies to our individual speakers on those. And we'll be sharing in due course the full paper that Vinay has led on the subject of equity and governance and the role of civil society organizations in COVID-19. I would like to request in traditional style that the all participants give us some feedback regarding the webinar. We will be, you don't need to take this link down. You can take a picture of it if you wish, but we'll be sending it to you. We do appreciate feedback, and if there are any further questions, we'd be very happy to try and respond ourselves or reach out to those that can provide assistance. So I would then now like to go to our closing remarks from my departmental head, Bruno Carrasco, who is the Director General and Chief Compliance Officer of the Sustainable Development and Climate Change Department of Asian Development Bank here in Manila. So Bruno, over to you, please.
Thank you very much, Chris. I hope everyone can hear me.
Yes, sounds
All right.
good.
Good. So I was unfortunately coming in a little bit late and then was disconnected, but I think I did manage to get what I think was an excellent set of presentations. I very much enjoyed listening to all of you. This work in some ways originated back in late last year when we were discussing with Vinay and Chris the more active role of civil society in the context of the pandemic. And I'm very glad to see this finally pushing through. And I think it was very, very much worth the wait. Today, we have learned about the unequivocal role of civil society organizations in strengthening immunization services. Finally got it right. And this, of course, is largely has to do with two fundamental roles of civil society. One is the advocacy role, as Vinay had clearly mentioned, and the other one is the service provider role. These two roles are essential, and we often feel that maybe it's more the advocacy role, but in many countries, service provision relies on outsourcing to other external parties, including civil society. As far as the advocacy role is concerned, it's in large measure about checks and balances in the system and ensuring equity in the allocation and distribution of vaccines. We certainly have heard today a lot about trust and the need to build trust. And whenever there is lack of trust, this can get in the way of getting populations immunized quickly. We've heard that in many of the communities, we still feel that there are equity problems. And even in terms of trust, many communities, through their own cultures, through their own languages, have greater trust in their local community leaders than perhaps in their presidents. So again, a very important role here. In terms of service provider, we've learned about how outreach is essential. And whenever we look at service delivery, we look at it from two angles, from a governance lens, if you like. And one of them is access, and the other one is quality. Access can be both being able to access the vaccines, so be registered in the systems, and that a lot of times is not a smooth process. But also, in many cases, it's about affordability and pricing. In this case, we feel that to the extent that that vaccines are being provided free, that is less of an issue. And then from the other angle, service provision and service outreach is about quality and ensuring that quality. And here we heard from Patrick early on a lot of the concerns about vaccine hesitancy, for example, and being able to use civil society to effectively communicate and educate the populations, whether there are small side effects when you take the first dose, or whether there is the recognition that you have to come back on a timely basis for the second dose. These are all examples of how the civil society can work to get the message out loud and clear. Important discussions also is about how civil societies do have a convening role. And that is something very important, because we can't assume that governments necessarily will have that role. So again, complementarities coming out between how governments can provide service delivery and how civil society can engage to complement that. There was also a reference, I think, in Patrick's remarks about how to mobilize communities. And I think an example that comes out very strongly is the what we saw with the typhoon Hainan or Yolanda in the Philippines, where we saw NGOs in many cases complementing, again, the government services and being able to reach the island and the far out places where access was less easy, and then again support government in delivering food and basic health in that context. So again, we've got a great example there. I liked from Jada's presentation the fact that we do have evidence-based results on the importance of civil society in being able to have an important key role in terms of strengthening immunization services. I think that the importance of stakeholders was very well recognized, and also the importance of having more impact evaluation studies to be able to confirm increasingly how the role of civil society has been very important. And I think this is something that I'd like to leave with the audience in terms of how we can build from this opportunity or this crisis in some instances to be able to strengthen that link. I'd like to also mention that we're very pleased that COVAX and Gavi do recognize the role of civil societies, and I think that is a very important step. Again, it's not just about having a voice, but it's also about being able to ensure accountability in decision making. And I think this is always a very key fundamental proposition whenever we're talking about good governance. There were a lot of many other good messages and takeaways. We saw from Vinay the experiences across different countries, and that was good to see. I think there certainly is a case for doing more knowledge work to be able to compare and contrast the experiences across countries. We know also certain countries have much more of a tradition of civil society engagement than others. Again, are there examples of how we can learn better whenever that is already in existence? So a lot of good things. I probably don't want to go any further. I am cognizant of time. It's late for many of you. So in closing, I wanted really to thank Vinay. Vinay, as Chris mentioned, is a friend and someone who we have worked with closely over the years, and we always learn from Vinay. Jada, it was great to hear you. We need to bring in more links with people like yourselves, who in many ways are at the front line and can bring those examples from your own operations and your own activities. Patrick, of course, who is our health guru, very, very nice, Patrick, to see how you framed the whole involvement and participation of civil society. We hope to be able to get a few more briefs, either governance briefs or health briefs coming out of this discussion. And Chris, thank you very much for presenting and organizing. You summarized every session very well, so that made my life easier. And finally, although I'm probably missing many people, but I know for sure Ali, Tony, Kate, and many others are people that you don't see on the screen, but are doing a lot of work, Romano also, in terms of making this a reality. So on that note, let me give you a big thanks. I also would like to thank all the participants. We had a very good participation, or some 80 participants, as I saw. So on that note, thank you very much, and we will continue to engage on this very important subject. Thank you.
Great, thank you very much, Bruno. I also add my thanks to all the speakers, Patrick and Jada and Vinay, the supporting team of the ADB's NGO Civil Society Centre and the governance thematic group that should work together both on the publication and this evening's webinar. And you mentioned the people behind this, the seeds. Let me add to that, our DOC and our IT people. We had some challenges a little bit at the start, so thanks for the help there. And of course, finally, for all those who have joined, the participants, if you have any further thoughts or knowledge, please do share that with ADB. Our NGO and Civil Society Centre is always looking for good examples to to share. There's lots of questions coming in, so your knowledge is important to us as we continue together on this very important development challenge for not only Asia Pacific, but for the globe. Thank you for joining tonight. And with that, I will wish you all a safe journey home. Those of you who are in lockdown, continue to endure and stay safe and stay healthy. Thank you. Good evening.
Thank you very much. All the best.
Thank you, everyone.